Hello everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Sue Jankowski. Welcome to Around Palos. And today we're learning about Medicare with a community educator and licensed insurance broker, Diane Ducey. Diane, thanks for coming here today.
Thank you for inviting me, Sue. I appreciate it.
Well, we always like having Diane come because she really is so knowledgeable about this topic, and that today we're talking about Medicare. And I think if you have any questions, hopefully we can answer a lot of them today because she is somebody who really knows her stuff. Also, just right from the beginning, you mentioned that you will be appearing at, did you say the library?
Yes, at the Palos Heights Library on October 9th, which is a Tuesday evening at 6:30. And that program will be Medicare Made Easy, which I've given there before, and is a good introductory program for people new to Medicare, but it's also helpful to people who've been on Medicare a while and would like a refresher.
And that's a good opportunity to, get your questions even from today, or if you have some unanswered questions, and that way you'll be able to talk to Diane right when she's there and ask any other questions that maybe she could help you with. So that's October 9th. A Tuesday, 6:30, did you say?
Yes, correct.
So you want to maybe write that down on your calendar, and I'm sure when we are talking to our friends from at the library program, we will mention it again closer to the time that that program will be coming, because you're going to want to maybe attend that as well. I do think sometimes Medicare can be confusing, and if you're new to it, even if you're old to it and been in it, sometimes there's changes made. Not sometimes. There are changes that are made. So I guess what we need to talk about today is, what's new with Medicare?
Oh, well, the biggest news is, and maybe people have received this already, Medicare is sending out new Medicare cards. In the past, and I think, for decades, they have used the Social Security number as the Medicare beneficiary number, which unfortunately has led to incidences of fraud and so forth. So they have changed that now, and now it will be a identifying number and letters combined. I believe that there are 9 letters and numbers used, and they are taking our gender off the card as well as our signature. So it'll just show our Medicare A and B effective dates and our Medicare beneficiary number. However, it is taking about a year for that to take effect for everyone in the country, because I believe there's 55 million people on Medicare. So,
wow, okay.
Yeah, so to issue,
take a while.
Yes, so to issue all of the new cards, of course, would take quite a while, but I have known people that have received them already, so that's good. They're still red, white, and blue, and they're just a little bit more streamlined.
Okay, and they still that lovely paper?
Yes.
So well, sturdy.
Yes.
Okay, well that's good to know. So that's something that's actually real, so you don't have to worry about, why am I getting this card? You really are supposed to get a new card and a new number, so that's good to know.
Good point.
Yeah, good. Okay. Anything else that's happening with them?
Actually, not that I can think of off the top of my head, but just Medicare, like I've always said, is very good coverage, and every year we have, new deductibles and new co-payments that people need to be aware of. And then, of course, there's Medicare Supplements, and how do we get our Medicare? Do we choose the original Medicare, which we'll probably talk about, or some people are interested in Medicare Advantage plans, and that's always something that people should be informed about as well.
Okay. Well, let's start at the beginning. So we're enrolling in Medicare, we're new to Medicare. How do we go about enrolling and getting your Medicare card, which now will be a new card? And that's actually a good thing that they're changing all of that.
Absolutely, right.
Okay,
right.
So we're starting out. We're brand new to Medicare.
Okay, so if you're turning 65 this year and perhaps already collecting Social Security, as some people do when they're 62, 63, or 64, if you're already collecting a Social Security benefit, you will receive your Medicare card in the mail automatically about 3 months before your birthday month. And the reason for that is that is the beginning of your initial enrollment period. So since Social Security is also the entity that handles the enrollment for Medicare, they are already sending you a check every month, so they know your birthday's coming, you're turning 65, they will automatically send you your Medicare cards.
Okay.
And even though they're sent to you about 3 months before you turn 65, they won't be effective until the first day of your birthday month. So, my birthday's in October. If I was turning 65 this year and collecting Social Security, I'd get my Medicare cards probably in July. My effective date would be October 1st.
Okay, so don't get too excited. You're going to get it early. You can't use it.
That's a very good point.
Wait till your birthday.
Right.
Okay, well, that's good to know.
Yeah, and you know, there's a lot of people who aren't collecting Social Security benefits prior to age 65. So for them, they will need to contact Social Security to initiate that enrollment, and they can do that up to 3 months before their 65th birthday. And how can they do that? They could go into the local Social Security office. We're lucky. We have that one right in Palos Hills on Roberts Road. And I always hear really good things about that office. But they could also, if they're just enrolling for Medicare A and B, they could go online. And that's a very efficient way to do it. They could go to the Medicare.gov website. That's Medicare.gov. And there's these 3 little green boxes on the home page. One says apply for Medicare A and B. They can click that and they can be enrolled in Medicare A and B within about 10 minutes with that online form. And that works for most people.
Okay, it does. But you're right, that Palos Hills office is actually very knowledgeable. They're very helpful. I mean, if you're feeling like, oh my gosh, I don't know what I'm doing when I'm clicking this box, or I'm not, I feel a little apprehensive about using the computer to do this, you have another way to do it.
Exactly, exactly. Yeah, and a person, if, you know, because then we, you know, think we're in metropolitan, you know, Chicago, but there are people in, you know, remote areas of the country that they don't have a Social Security office nearby. So people could always call Social Security and make an appointment by phone to enroll on the phone with the Social Security representative. So there are certainly different ways, but I have found the easiest way is either to go to your local office or to go online, and you could do that from your home.
Yeah, you can. Okay, so once you're doing it, so there's Medicare A, there's Medicare B, there's Medicare other parts, but what's the difference between like Medicare A and Medicare B, and do you get both of those at the same time, and why are they divided?
Okay, great question. So Medicare Part A, sometimes we consider that hospital insurance because it helps pay for our stay when we're in the hospital or a skilled nursing facility home, and we think skilled nursing facility, we usually think of that as room and board.
Okay.
And so Medicare Part A is very important, of course, because hospital stays can be very expensive, as well as skilled nursing facility. However, and Medicare Part A is premium free for most people because all the years that we are working, we are usually paying into the Medicare system. And as long as we have 40 calendar quarters paid into the Medicare system, we do receive Medicare Part A premium free. And if we don't have those work credit records under our own name or own Social Security number, we can use our spouses, and we can get Medicare Part A premium free through our spouse's work record. Okay. So that's good. So back to your question, A covers hospital, B covers physician's care. Physicians. Right. So, and you know, they usually say medical, but you know, Medicare Part B covers the physician's care that we get in hospital, surgery, anesthesia. Also, it covers simple office visits. So Medicare Part B covers, in addition to physician office visits, you know, surgery, emergency room care, ambulance care, many things. And it is the combination of A and B together that really forms the foundation of our medical care when we're 65 years of age and over. And Medicare Part B is not premium free. There is a standard premium for Medicare Part B this year, and that's $134 per person per month. That's the standard premium. Some people pay more because it is based on income. Okay. And so every month you're going to pay that, or you're going to make an agreement with them that you pay on a yearly basis, an annual basis? Well, with Medicare Part B, for people who are already getting a Social Security check, it'll come right out of their Social Security check automatically. Oh, I see. Okay. But for those people not collecting Social Security yet, right, because they may be waiting until 66 or 67 or 70, then they are billed by Medicare, and that can be done on a quarterly basis, or they can put it on a credit card, or they can use something called, I believe it's called Medicare Easy Pay, and then they can pay it on a monthly basis that way. Okay. So, but those actually come hand in hand. I mean, you can't get A without B. That you have to have both of those. Well, not necessarily. You could get A without B, because some people are still working beyond the age of 65, and if they are still employed by a company with 20 or more employees, actively at work and getting coverage through that employer, they can keep their employer coverage for as long as they continue to work.
Oh.
However, they may say, I think I might enroll in Medicare Part A, simply because it is premium free for most people, and they can have that sort of just enrolled in A but not yet enrolled in B.
Okay.
That's if they choose to do so, and I always suggest that people speak with their HR department about that as well.
Okay, so that's possible. Okay, so A and B are, you don't pick your provider for A and B.
Well, no, you just need to use a Medicare approved provider, which most physicians in the country accept Medicare. So with original Medicare A and B, we have a lot of freedom of choice when we're choosing our physicians, and so there's not really a set network.
Okay.
And so just Medicare approved physicians. And by the way, when I was on the Medicare.gov website yesterday again, there's a great spot on the homepage where it says resources on the far right-hand side. And if a person clicks that, they can look up any physician in the country, any hospital in the country, and find out if they accept Medicare. So that's very beneficial.
Oh, that's really helpful.
Yes, it is. It is.
Okay, so we have Medicare Parts A and B, and then there's more parts to Medicare, but there's also then supplemental insurance, which, explain why you need supplemental insurance. I mean, look, you got, the hospital coverage, you've got the physician coverage and surgery. I mean, what else do you need?
Well, Medicare covers inpatient hospital stays and skilled nursing, but it doesn't cover it entirely. So there are deductibles and co-payments and co-insurance amounts left for Medicare beneficiaries to cover. For example, under Medicare Part A, there's a deductible when you go into the hospital, and that's $1,340 this year. And so that's considered the Medicare Part A deductible. The benefit period under Part A is a little unique. It begins when you go into the hospital, and it ends when you've been out of the hospital and or a skilled nursing facility for 60 days. So if I were to go in the hospital, say on June 1st, that's when my benefit period begins. If I'm discharged on June 6th, then I go home and convalesce, and 60 days go by without me re-entering a hospital or skilled nursing facility, my benefit period ends 60 days after that discharge date. So that would be, August 7th, something like that. So if I were to go in the hospital again, maybe in September, I would be starting a new benefit period, and a new deductible would have to be satisfied by me.
Oh, wow. Okay, so it's not a deductible for the year.
Right.
It's just per usage almost.
Well, no, not necessarily per usage. It's because, so if I were to go in the hospital June 1st and be released on June 6th, and re-entered, say 4 days later, I'm still within my same benefit period.
Okay.
Because I did not have this 60-day consecutive day break.
Okay.
So it's a little unique. However, it really benefits Medicare beneficiaries because we really don't run out of benefit periods. And every time we begin a benefit period, even though we have that deductible, we have 90 days of hospitalization coverage available to us. 60 days covered in full, and additional days 30, 61 through 90, where we have a co-payment to be responsible for each day that we're in the hospital. And that co-payment this year is $335 a day for days 61 through 90. And that can be expensive, but fortunately, we can get a supplement, and that Medicare supplement picks up that co-payment as a basic benefit.
Oh, there you go. That's the reason you really need to have that.
Right. So Medicare Part A deductible can be covered by a Medicare supplement by most of them. The co-payment of $335 a day is considered a basic benefit and covered by all Medicare supplement plans sold. And then there's another co-payment for hospital days, and that would be if we need to stay in the hospital longer than that original 90 days, for days 91 through 150, we also get coverage. However, our co-payment doubles to $670 a day, and again, the supplement picks that up as a basic benefit. So a lot of people, maybe it's easier sometimes, to have a visual of Medicare A and B being the foundation of your care, and then on top of that you have another layer of coverage known as a Medicare Supplement to help you with deductibles and co-payments and some other costs that Medicare A and B leave you to pay as well.
Okay. Now, am I right in my understanding that they have now kind of made the supplements have to follow certain criteria so they're similar to each other?
You're absolutely right.
Okay.
Yeah, they were standardized in 1992, and many people think that Medicare supplements were designed by insurance companies because that's who sells them.
Right.
However, they were actually designed by Medicare to specifically work with Medicare A and B in the original fashion. And when they call Medicare A and B original, it's because we can still use Medicare A and B the way it was originally designed back in 1965, with that freedom to use any Medicare-approved physician, hospital, and provider in the country. So with the supplements, they are designed specifically to help with the Part A deductible, the co-payments. Skilled nursing has a co-payment as well of $167.50 a day for days 21 through 100. The supplements can help with that. And with Part B, which is typically more like what we would think the way coverage we grew up with, like 80-20 coverage. With Medicare Part B, there's another deductible. Fortunately, it's a calendar year deductible, so very straightforward. And that's $183. And Medicare Part B covers 80% of the Medicare approved amount, leaving us with a 20% portion to pay, which is known as coinsurance. And the supplements can help with that as well. So the supplement, for everything that Medicare A and B leaves you to pay for, you can get a supplement to pick it up if that's what you want to do.
Okay, but you don't have to if you don't want to. I mean, it's not like something you have to do, but you probably should do that.
Yes, you are absolutely right. Not something you have to do, probably you should, because we all want to protect our own financial assets.
Right. And, oftentimes, not always, but along with age comes some medical issues that might need to be addressed, and you do want to be protected with your income maybe changing at that point too. So that is a good thing. Okay, so now we know we have A and B, and we know there's no choices with that. You just kind of get that. There are choices with the insurance companies. Is there some reason why you would choose then, because they're standardized, is there a reason you would choose one over another?
Oh, sure. There's 10 standardized plans, and they are alphabetized, unfortunately, right? Because we are talking now about Medicare Part A, and we'll talk more about Medicare Part B. However, with the supplements, they are also named by letters of the alphabet, which can cause some confusion out there. So Medicare Supplements for A, B, C, D, F, G, K, L, M, or N, right?
Wow. Okay, not even in, like, they left some letters out.
They left some letters out, right? Yeah, years ago there were some fill-in-the-blanks there, but since they were not typically purchased by most people, then Medicare decided to withdraw them from the marketplace, because why have something available if no one's purchasing it?
Right.
So with Medicare supplements, they were standardized in 1992. Makes it easier for all of us, because if I know I only have 10 options to pick from for a Medicare supplement, and I know that if an insurance company, if they're selling all those 10 options, and let's just say Plan F is Plan F is Plan F, Plan G is Plan G is Plan G, it makes it easier.
It does.
Right. I can choose my company based on reputation and price and some other factors as well.
Okay, so that's what you're going to do, is you're going to choose the company based on what they offer, plus price, plus reputation.
Well, that's what I think a lot of us do. Even when we're purchasing insurance for our cars and our home, we tend to look at the reputation of the insurance company first, and then of course we look at price, right? Because if we just look at price, we might buy something very inexpensive, and maybe some other services are not as stellar as others, like claims paying ability. Right. Because most often when people have medical issues going on, sometimes it's sort of frightening to get all of a sudden notices from the doctor about bills being paid, or this has been submitted to your insurance company. So it is helpful to have insurance companies working for you that pay their claims on a timely basis. Right. So that's something people should take into consideration. And another item would be price, of course, because prices can be all over. I represent a few different insurance companies, and because people like to have choices.
They do.
Right? And so some insurance companies, you know, if you are with them and say you enroll in one of the Medicare supplement plans and you want to switch to another, that insurance company may let you do that without any medical questions asked. And that gives people a lot of flexibility. Because, you know, when we're making our decision, we don't, you know, we would think, what if I change my mind?
Right.
Right? You want to be able to change your mind without worrying about, gosh, am I going to have to go through medical underwriting or something to switch my plan later on? And if you don't mind me digressing for a moment, it's just that, you know, this annual election period that comes up every fall.
It does, yes.
And a lot of people think, well, I can switch my supplement during the annual election period every fall. But that annual election period is really for Medicare Part D, prescription drug plans, which we'll probably touch on, and Medicare Advantage plans. It's not to necessarily switch a Medicare supplement plan. Oh. Because when people are first going on Medicare A and B and turning 65, they have what is known as an open enrollment period for a Medicare supplement, and they can purchase any Medicare supplement plan of their choice without asking any medical questions or being asked medical questions or having waiting periods for pre-existing conditions, and that's great. However, that is their one open enrollment period for the Medicare supplement. So after that, insurance companies could say, oh, you're coming to us after being on A and B for more than 6 months. You know, let's check out some medical issues with you to see if you qualify for this plan.
I see.
Not all insurance companies do that, but many do.
That is an option. So when you're making that initial choice, you want to be pretty certain that you're choosing as well as you can at that time.
Right. That's why, you know, just like anything that we purchase of, you know, significance, a car, a home, anything, you know, we want to be an educated consumer.
Right.
And because the more we know, the better choices we are making. So I do think it is important for people to go to programs and listen about Medicare and Medicare supplements and just to do some research, because once they choose a plan, many people then will keep that plan the rest of their lives because they have made a good choice and they're satisfied with their choice.
Right, exactly. Now, before we go on to Medicare Advantage and Part D, let's go back to Part B for a minute, because you mentioned making sure we covered everything there. Is there something else we need to know about Medicare Part B?
Well, Medicare A, like I said, is hospital coverage. Medicare B, medical or physician's care. And there is a deductible that we're responsible for. That's a calendar year deductible of $183 this year. We have a premium for it, like I mentioned, and that premium could be different for people if they have higher than average incomes. And then Medicare Part B does cover 80% of the Medicare approved amount for Medicare covered services. We, as Medicare beneficiaries, are responsible for the remaining 20%. We could be responsible for something else also, and that's called an excess fee. An excess fee is where, when I am using Medicare-approved physicians, it is in my best financial interest most often to use a doctor who accepts Medicare and something else known as assignment, Medicare assignment. If that doctor elects to accept Medicare assignment, then they are saying that they will accept the Medicare-approved amount as payment in full. So if I go to the doctor for an office visit, and let's just say that visit is $100, the doctor submits that to Medicare. Medicare may only approve $80 of that visit, and then it is their policy to cover 80% of that approved amount. So now we're at 80% of 80, which is $64, and I'm responsible for the remaining 20% of that approved amount, which was $80, so $16. So if I pay my doctor $16 and Medicare pays them $64, the doctor may be satisfied with getting $80 of the $100 they charge, or they may not be. What really determines that is if they accept Medicare assignment or not. Again, accepting Medicare assignment simply means that doctor has agreed to accept that Medicare approved amount of $80 as payment in full. I was responsible for 20, Medicare the other 80. If the doctor says, you know, I accept Medicare only and not assignment, then they could charge me what is known as an excess fee. An excess fee can be up to 15% of the Medicare approved amount, and in this example today, 15% of $80 is a small amount. It's $12. However, you know, that same doctor could perform surgery, and the surgery is certainly not going to be $100. So by a doctor charging an excess fee, that's no problem. However, as a consumer, I may say, well, gosh, I always want to use doctors that accept Medicare assignment, or, as many people do, I want to be able to use any Medicare-approved physician in the country, right? That's my freedom of choice.
Right.
So fortunately, if I choose to use doctors that accept Medicare assignment only, I don't worry about excess fees. But if I want my freedom of choice completely around the country and use a Medicare-approved provider, I can get one of the Medicare supplements. Actually, two of them currently sell what is known as an excess coverage, and that's plans F and G, and they both offer that coverage. So then I can pay for the supplement to cover me in case I use a doctor that accepts Medicare only.
Oh,
right.
Wow. So you need to actually find out ahead of time, does your doctor or the doctors you're going to accept Medicare assignment, and then make sure that's okay with you, or do you need another supplement to go along with that?
Absolutely.
Okay.
And so some people, they'll say, well, you know, all my doctors accept Medicare assignment, and I'll say that's fine, we can go with this choice. Or they say, but you know what if, you know, I need a doctor who doesn't accept assignment, then they can make another choice. And that brings up something else, you know, Medicare supplements, just like Medicare, it's an individual choice. So if, say, you know, my husband and I both wanted a different supplement, we can certainly do that. We can certainly go to a different company, each of us as well. So it's not like everybody has to have the same thing.
Okay.
We have choices.
We do have choices. Okay. Well, that is so, see, this is why people start with Medicare and think, oh my goodness, there's so many details and choices to be made, and you really need to be an educated consumer, or you're not getting the full value of what you need for health coverage, really.
Absolutely, and that Medicare.gov website that I mentioned earlier, that offers a lot of information, and then everybody does receive a Medicare and You book every year, usually in the fall.
Yes.
And you know, it's always funny when I give a presentation, I'll say, how many have read it? And I get maybe one hand that goes up, right, out of 20. However, and I understand that completely. I mean, I like it, right? And I like insurance and I like Medicare. So for me, it's very interesting. But for someone who is more interested in, say, journalism or some other thing, they might not be willing to pick up the book as quickly.
I'll read this when I need to sleep.
Yeah, that's true too. That's true too.
But it is important. It is important. You're getting the information. It's available lots of ways. I mean, they really try and educate everyone. So, I mean, you have the ability to find out a lot of stuff. Okay, so now, knowing that, then there's still Part D, and there's also a Medicare Advantage program, which I know we've talked about that before, and I know the D stuff, but I don't remember the Advantage part of Medicare.
Okay, so with Medicare A and B, you know, hospital, medical, physician, and a Medicare supplement, that other layer of coverage, and those combined, I can use any Medicare-approved provider in the country with original Medicare and a supplement. None of those three cover Medicare prescription drugs, right? So that's where the D comes in that you mentioned and that you're familiar with. And Medicare Part D, that's what we need to buy if we want outpatient prescription drug coverage. And that is available in Illinois through about 24 different plans. And again, Medicare.gov is a great source for that. And
24 plans, that's a lot to go through.
Yes, and just briefly, and then I'll answer your question about Medicare Advantage. Medicare Part D, even though there are 24 plans, and that can be a little overwhelming for us as consumers to choose from, first of all, a person should know they don't need to buy their Medicare Part D plan from the same company as their Medicare Supplement. There's no advantage for them to do that. They can make independent choices, and that Medicare Part D prescription drug plan, on the Medicare.gov website, there's a fantastic software program, again, easily accessible by going to Medicare.gov and clicking the green button, Drug and Health Plans. And then it just leads people through this process, asking them for their zip code, asking them how they get their Medicare, asking them what their prescriptions are. That will then eventually lead them to the Medicare prescription drug plans that will most efficiently or most cost effectively cover their drugs for the remainder of the year. And I know I do this like every day for people, so some people will do it and say, gosh, it wasn't that easy, but it is. It's just, you know, it's just like any task for the first time that we do it, right?
It can be confusing.
It can be confusing, so a person could walk away and go back later on, so that's okay. But I do strongly advise people to get help with that, either by going to the Medicare.gov website and looking it up, or, you know, calling an insurance agent, or, you know, utilizing plows, you know, here in Payless, and they can help them with that as well.
Because that's really, really important. Now, can you get Part D at any time, or is there open enrollment for that also?
Actually, the enrollment period for Part D is the same as Medicare A and B, up to 3 months before you turn 65, the month of your birthday, and up to 3 months after. So actually, there's a 7-month window when you can enroll for Medicare A and B and D. However, if you want that coverage the first day of the month in which you turn 65, you need to do it before your birthday month.
Okay, well, what if you don't get it at that time, and now you're 70 and you want Part D?
Okay, very good question, Sue, and that gets asked quite a bit. So some people will say, well, you know, I'm not going to enroll in Medicare Part D yet. Well, that's fine. They can enroll in it any time during the annual election period in the fall, October 15th through December 7th. Their coverage would be effective January 1st. And for those people who are still working, going back to those people who are still working full-time and maybe not enrolling in Medicare Part B as in boy or D as in drug yet, they'll have a window of opportunity in which to do that when they're ready to terminate their employment. But for other people who just say, you know what, I don't want Part D, I'm not going to get it yet, well, when they do decide to enroll, maybe at age 70, then they can enroll in the fall, like I mentioned. However, they may pay a penalty, more than likely, because if they didn't have coverage due to active employment or maybe VA coverage, Veteran Affairs coverage that would be considered credible, Medicare will say, well, where have you been covered since you've been 65? And if they just say, well, I just didn't have coverage, then they could pay a penalty. And that penalty is a lifelong penalty, which a lot of people don't necessarily realize.
No.
Right. So this year, the national average Part D premium, you know, across the country, I believe it's $35.02. And so the Medicare Part D penalty is 1% of that, you know, which is small, 35 cents, but then it's multiplied times the number of months a person could have been in a Part D plan but chose not to be. So in your example of age 70, if we had 60 months go by, 60 times 35 cents, okay, about $20 a month, right? Give or take a few cents. That would be the penalty that person would have to pay every month the rest of their life, in addition to the Part D premium that they choose.
Right.
So, you know, I've had people come up and they say, gosh, you know, my mother or my father never took a plan and it was for 10 years. Well, now then we're talking like probably a $40 penalty. So not to be, you know, it's a person's choice. They say it's voluntary, but there are penalties to pay if a person does not enroll when they should.
Just so you're aware that, you know, and that maybe that's okay with you. You know, you think,
if
I've saved all that money for 5 years, 10 years, or whatever, and that's just what I have to do.
Absolutely, absolutely.
Okay. Well, let's touch on the Advantage plan so that, you know, our viewers can learn about that a little bit.
So with original Medicare A and B, you know, using any Medicare approved provider in the country, you can couple that with a Medicare supplement to help with the costs that Medicare A and B leave you to pay. And for outpatient prescription drugs, you could buy that prescription drug plan, a Medicare Part D plan, through an approved company. There's another way to get your coverage, and it's called Medicare Advantage, also known as Medicare Part C. For Medicare Part C, you want to think of that C as standing for combining your A hospital, B medical, and D prescription drug plan into one plan. Most Medicare Advantage plans include that prescription drug coverage. The big difference between a Medicare Advantage plan and original Medicare is that with a Medicare Advantage plan, you typically do need to use a network of doctors and hospitals, either an HMO type plan, health maintenance organization, where you need to use doctors and hospitals in the network, typically choose a primary care physician, and usually get referrals to see specialists within your network when you need to see a specialist. And if you go outside of that network for anything but emergency or urgent care, you typically pay more or all of the costs. And a PPO, a lot of us have been covered by a PPO, participating provider option. With that type of option with a Medicare Advantage plan, you get, higher level of coverage when using your participating provider, hospitals and doctors and other providers, and then less coverage if you go outside of the network. And you typically don't need referrals on a PPO. However, this Medicare Advantage plan, you may be wondering yourself, well, gosh, Diane, have I described an advantage yet, right? And the advantage to a Medicare Advantage plan is that it can be less expensive as far as premium goes than a Medicare Supplement. You see, Medicare Supplements, let's just say at age 65, the most expensive plan may start out at about $158 a month, something like that, and it gets more expensive as a person ages. With a Medicare Advantage plan, you can sometimes purchase them for $0 premium a month, but then, and that's certainly an advantage,
It
right?
sure is,
okay.
right.
However, with a Medicare Advantage plan, you will have costs for your services when you receive them. They may be very low. They may be a $5 copayment or $0 copayment to see a primary care physician, or $50 to see a specialist, and maybe a copayment of $200 for an X amount of days while you're in the hospital. So those are things people need to weigh. Number one, are there doctors in that Medicare Advantage plan that they're looking at? Are they comfortable with getting referrals to see a specialist? What are their costs going to be? So we don't always know that, right? So they have to look and see what is the potential, because all Medicare Advantage plans do have what is known as a maximum out-of-pocket limit, and that would pertain to covered medical services. So if a person is enrolled in a Medicare Advantage plan, and let's say they have a bad year medically speaking that year, they would know that if they hit a certain dollar amount, known as the maximum out-of-pocket limit, then for the remaining of the calendar year, they would have all covered services covered at 100%. So those maximum out-of-pocket, I think the highest in Illinois can be, in the country it can be, is $6,700 this year. But Medicare Advantage plans can have a much lower maximum out-of-pocket limit as well. So some people really like Medicare Advantage plans. And again, when you're talking about a married couple, if one spouse says, I want a Medicare Advantage plan, and the other spouse says, I want original Medicare and a supplement, that's fine. They have individual choices, right?
And as long as they know, that's a great advantage that you're not, paying a monthly bill or anything like that. But you have to be comfortable with the fact that you're not necessarily choosing the doctor that you want to choose. It's a little bit, it has to be in that network.
Right.
And it could be a lot of great choices.
A lot of great, and a person's own physician could be in that Medicare Advantage plan. Maybe all of their physicians are in the Medicare Advantage plan, and those are things that they should seek out. And like people say, well, how do I choose? Well, they could look at the back of their Medicare and You book, and they're going to show all the drug plans and Medicare health plans known as Medicare Advantage plans in Illinois, or they could start with their doctor and say, hey, listen, do you belong to a Medicare Advantage plan? And if so, which one? And be specific if it's a PPO or an HMO, and speak with their doctor first, and then maybe start the process.
Right. And actually, you may already have specialists that you go to on a regular basis, and you could do the same thing with them. You're a regular physician, and then your specialist you go to and see if they're part of that.
That would be good. On PPOs, fine, because they wouldn't really need referrals. On HMOs, a person would want to make sure that that specialist would be the one that they're referred to by that primary care physician. So it may take some phone calls, but very worthwhile to take the time to make the phone calls, because Medicare Advantage plans can include things that original Medicare does not. Like routine eye exams and help with hearing aid coverage and sometimes dental. And so there are advantages to each. There is an advantage to having a Medicare Supplement. There's an advantage to having a Medicare Advantage. And we as consumers love choices.
We do. And so I guess it's up to you to figure out what works for you, what works for your spouse, and get through that together. So, Diane, can our viewers, can they call or email you or something if they have a question about
sure.
something?
They could call me. Do you want me to say my number?
If you don't mind saying your number, and then we'll put it up on the screen so you can write it down.
Okay. It's 708-712 1348. And then my email address is dadduci@comcast.net.
Okay. Because I kind of feel like this is like a springboard for some people that they didn't really think of that. Maybe you don't want to wait till October 9th to ask Diane more questions. And maybe you do, and that's just fine. But in the meantime, you have a way to reach out to her. She's just such a great fountain of information. Okay. And I mean, my goodness, it seems so complicated, yet you simplified it for us, so we do understand. I've listened to Diane talk about this a few times, and it always is made so much more clear after I listen to you. But you know, then the memory kind of fades sometimes. So that's why I'm suggesting that you call Diane or ask her a question on email if some of these things you think, oh, I wasn't sure about this or that or the other thing. I'm sure Diane would be very happy to help you.
I welcome the questions.
Great. Thank you, Diane, for being
here
again
Sue.
with us today. We really enjoy having Diane. She's always a great guest. Thanks for watching us, and we'll see you around Payless. Bye.